Literally the day before I came here, I was so weak and so dizzy that I was afraid to drive. At that point, I had had Lyme for about 3.5 years, and there was always this question about how sick I was with Lyme, if it was chronic, or if there were other kind of infections and issues going on because I had had Lyme for so long. So I had been kind of living with years of chronic fatigue, brain fogginess. The dizziness would go in and out. I couldn't metabolize anything. It just came to a point where I knew something was really wrong with my body. I just didn't know what was actually going on. Initially when I got Lyme, I was at a mainstream doctor and we treated it with doxycycline 3 times, which was really hard for me to even get 3 rounds of doxycycline because it is such a strong drug. So I turned to you guys to see if this was a place that could answer the questions that I had, and thankfully you guys did. Holly was a great help. She was the one who took my phone call and got me in right away. The doctor heard my story and she knew right away that I would be a challenge. She said that to me. She goes, "You are a challenge," that I'm willing to take that on. We started right away on a back to wellness program, got me on the IVs right away, and took tons of tests, blood tests, to see exactly what was going on. It was the first time I had felt hope about not being sick for a really long time. So I'm very thankful for each of the staff here because they were just very attentive, kind, understanding, and helped the experience for sure in the process of getting well. The initial results of the tests, I had about 7 other kind of imbalances, co-infections along with my Lyme. The most alarming thing was my CRP reading, which talks about your inflammation. You're at a high risk at 3 and I was at a 72. So my body was severely inflamed and I felt that. So I'm now down to a 0.6 for my CRP reading, and we recently tested my Lyme and I came back negative, which is not something that's supposed to happen because once you test positive for Lyme, you always test positive. So that was pretty big. So there's still some things we're working on, but the source of what's caused me to be so sick for so long is now gone, which is great.